Good morning. This is Dr. GERARD CUOMO. I'm here with a Branemark case. It is a rescue case where we are intervening with new parts, and our patient Larry's been patient with us here on the waiting for these parts to finally come in. We went through two places for the origin of the new parts, and these are certified Branemark parts, one of which is the Nobel Biocare company. The other is Implants Direct. So combination of the two, we're able to come up with the extra parts. Now, I've placed my patient overnight, or a few nights, with the healing abutments, of which the distal healing abutment was somewhat irritated due to some tissue impingement. We were able to relieve that and allow that tissue now to calm down. We've also added a topical anesthetic along with a blue material that is it from what? It's called Hemasil by Kerr Company. Topically placed for about 3 to 5 minutes and then rinsed off. So now we're ready to go. I'm going to start with number 20. And I've already loosened it with my driver, so I'm just going to go ahead and use my fingers now. And what we're going to do is recheck the threads. I have to look all the way down inside the implant and check for any more bioburden. As you recall, we used tartar and stain remover, and that worked out pretty well. So I'm going to go in and check now with direct and indirect vision using a dental microscope. So there's our tooth, or I should say our implant, and the tissue looks good, but we're going to go ahead and scrub that first with cavity cleanser. I'm using an end spiral brush tip with that, and I'm just going to go and make my way around this with this brush right now. And not to stir things up, but just to remove any tissue tags that might have aggravated in the area. So it looks good. Go ahead and dry that off gently. All right. And again, we're going to go down inside with cavity cleanser, which is a soap, basically a soap material. And it's hard to reach all the way down there, but we'll fill that up with cavity cleanser. It's also found in Paradex. That's an oral antiseptic. And I'm going to use a small color-coded green proxy brush. I'll go right down in there and try to twirl it counterclockwise mostly. And go with the threads. Alright, so we spin that. Let me back up in magnification. There we go. It's in, it's spinning. And just continue to do that. Now I'm going to take a good look at our brush to see what has come out. Actually, I'll go right over to some white paper. And I'll just smear it onto the white paper to see if there's anything that's come up out of there. It's pretty clean. On a microscopic scale, nothing. Alright, so now we'll take a look down visually to make sure there's nothing that's dried down inside. As you recall, we used tartar and stain remover, where we injected it down into the threads, and then we were able to dissolve most of the byproducts that were locking the broken screw in place. So, okay. Okay, so right now things look relatively good. I'm going to head change cotton roll. microsuction tip. Okay. Basically, we're using just a 20 gauge syringe tip. Used an endodontic so we can get in there. Looks good. Tissue response looks good. And the implant head looks great. So we can go ahead and tighten down our first part. It is a 3mm Branemark abutment, standard abutment. The you can close, Larry, and rest a little bit. Attachments International actually stock these, and that company's been purchased by Implants Direct. But here it is, Branemark Standard Abutment 3.0. Reference number is 420011030. That would be the 3mm, and the 4mm follows in suit to that. All right, and what you get inside basically is the tissue extension, and this screw right here is the one that did fracture off. I'll show you the fracture component. It's just the top portion. I'll just show you how that, and the O-ring and the condition of the O-ring itself. That O-ring is in there for a reason. I assume it's there to keep bacteria from piling down in there, and also acts as a shock absorber and a centering device for the screw itself. So we have to get these two parts out, and we'll assemble those together out of the mouth and then bring it to the mouth. So here we go. There's a bevel to these, and you have to keep the bevel down toward the tissue because it's tapered, and they want the tissue to taper to that. So through the top, and it'll bottom out inside. Okay, just like that, and then just push that all the way in, and you'll see that there's definite tension now. That ring is holding very nicely. And now your driver goes on top, push it all together, and then now the most important part is to tighten to 30 Newton centimeters squared. Okay, don't over tighten, just enough torquing. 30, not 35, 30. The newer implants now you can tighten to 35, but this has its own specifications on tightening. So here we go. Turn toward me, Larry, a little bit. So just hand tighten it first. Okay. Larry, you feel anything? Any tension? No. Okay. See, now the component is dropping down into the cylinder. Okay, so it countersinks. So you get the tissue side gets the bevel, and then the top. Now see that extension sticks up 3mm in height. Now how do we know it's 3? You take an X-ray, and the old we were able to acquire an old X-ray and it showed the vertical height. So that's one way to do it. The other way is trial and error. You'll have to just try them in, hand tighten only, and then try them in. All right. So that's the first one, and I'll just hand tighten it again. And I just asked Larry, and he said he didn't feel anything pinching, so that's good. No tension there. So first one's in. Now we'll take the one in the back. Now the distal abutment was the problem, one area, because the tissue did grow over the abutment, and it's a hex head, so we've conditioned it. Let's see how we did. So far so good. All right. Here we go. All right. Again, loosen it, and then these are nice. They're round. Yeah, parts are not easy to find, especially today, and the prices have almost tripled because they're parts that no one makes anymore, and they're on the shelf. So maybe the best thing to do is to buy and keep a supply if you're knowing you're going to have a lot of these cases to do. Now I'm going to rinse that out with this material. We'll just have some suction. So there is a tissue tag immediately I saw right in there, so that came out. Now I'm just, again, I'm using chlorhexidine, gluconate. It's 4.0. If it's called cavity cleanse, I mean they're all over. You can get the ones from Ultradent. It has a little better taste. My dental assistant here, she's saying that this is much better taste for your patient. So I got to go back down in there now with the, again, with the proxy brush. Let's see what we get out. So we'll do the same thing. Go to the counterclockwise. And I got to work a little faster with this one. Alright, and what we're looking for is just something to come up on our brush. So go to white paper and wipe it. Now we might have a little bit of coagulant at the top, but visualize. I don't see anything like we were looking at in the other video, which was granules of tartar and stain. So that looks clear. And we're going to go in and actually suction out the threads. So again, chlorhexidine, gluconate. Flushes it out. Then we go in with microsuction. The least amount of trauma. No. Just retract only. Okay. And retract the lip if you can. Go. Alright. So we're just following suit. I've got the next assembly. This is the 4.0. Again, the bevel side toward the tissue. Insert the screw. Push down. Now you've got your external hex driver ready to go. Alright, and that'll engage into the hex head. You see there's an internal hex here to go into the external hex. When that bottoms out, everything will seat properly, and you won't have a gap space. Okay. 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 You can come out, please. There we go. Okay, Larry, open up just a hair whitener. And you can steady in the middle of the driver with an instrument because there's a depression area. As it goes in, it should stop spinning the transmucosal, and then you'll engage solely the screw as it goes down. So now if it doesn't seat all the way, then you'll be tightening, and the problem with that is that you think you're tightening the screw, and then it's the external and internal hex heads haven't lined up properly, so it's a little jigsaw puzzle. Don't make that mistake. Alright, that bottomed out nicely. It's nice and firm, but you got to confirm it with an x-ray. Alright, so before I take the x-ray, I'm going to try the bridge in without any screws just to see how it bottoms out in my hand. I'm going to use my own feel as a reference. So I'm just looking now to see if there's any rocking, obvious rocking in the bridge. And so because the prosthetic screws would then go in next. So make sure I got this. Larry, can you turn a little toward me, please? Thank you. There we go. And as you can see, they both align perfectly. All right. So no gap spaces. So I still, you don't want to really torque drive things down without knowing for sure. So you can do one or two things too. You can feel with the small Explorer very gently, not to disturb anything, but just feel the side. You can also use microsuction. It's another method, but I don't feel any gap spaces, so it feels good. So I'm confident that we're down. Now you can look on the lingual and check the lingual. Nothing there. Nothing there. So I can now just torque drive these down. And we're going to go to 30. Alright, so I'll be right back with that technique since we're coming up on the 15-minute marker. Alright, back next time.